So, hello everyone. Now we are going to study regarding the treatment of tuberculosis. It's divided into two phases: intensive phase and the continuation phase. Intensive phase, the duration is of 8 weeks, and continuation phase, the duration is of 16 weeks. Now, the duration of intensive phase and continuation phase might vary depending upon the type of TB. In multi-drug resistance TB, pre-extensive drug resistance TB, and extensive drug resistance TB, the intensive phase and continuation phase might vary. Okay. Continuation phase is of 16 weeks. It might be extended by 12 to 24 weeks in disseminated TB like meningitis TB, meningitis, CNS TB. Other than pulmonary TB is disseminated TB, right? Then treatment regimen, intensive phase. In intensive phase, the medicines which we take is isoniazid, rifampicin, pyrazinamide and ethambutol. And continuation phase of 4 weeks, we take isoniazid, rifampicin and ethambutol. Alright, so streptomycin is given in certain conditions only, like TB, meningitis or adverse drug reaction against isoniazid, rifampicin, pyrazinamide and ethambutol. Otherwise, streptomycin is not included in the standard treatment regimen, only in cases of allergy towards the HRZD or in case of TB, meningitis only we give streptomycin. Coming to the mechanism of action of the anti-TB drugs. Now, rifampicin. So, this is important for the second year medicos and also NEET PG point of view. They might ask you the mechanism of action. Now, the mechanism of action of rifampicin. Rifampicin is bactericidal drugs. We know pharmacological point of view, there are two drugs, bactericidal and bacteriostatic drugs. Cidal drugs will completely kill the bacteria. Static drugs will only stop the multiplication of the bacteria. Now, rifampicin is such a drug which will completely kill the bacteria. It binds to RNA polymerase of the bacteria and it inhibits the bacterial RNA synthesis. Thereby, bacteria will not be able to divide and it will kill the bacteria. Isoniazid is also bactericidal. It inhibits the synthesis of mycolic acid. Mycolic acid is a component of a cell wall of Mycobacterium tuberculosis. The name of TB is derived from why the name of the TB is Mycobacterium tuberculosis, TB bacilli name. It's because of the content of mycolic acid which is present in the cell wall, right? So it will inhibit the synthesis of mycolic acid. All right. Then coming to the pyrazinamide, it inhibits the synthesis of mycolic acid, right? Same as that of the isoniazid. Then ethambutol, it inhibits arabinosyl transferase, thereby inhibits mycolic acid incorporation in the cell wall. Same, like almost same, isoniazid, pyrazinamide and ethambutol. Ethambutol, NEET PG point of view, they might ask you, ethambutol, which drug inhibits the arabinosyl transferase enzyme, which drug inhibits the incorporation of mycolic acid into the cell wall, which drug inhibits the synthesis of mycolic acid. Then coming to the streptomycin, it inhibits the RNA synthesis again. Now, streptomycin is a aminoglycosides. We know all the mycins are the aminoglycosides. All the thromycins, the name of the drug which ends with thromycins, are macrolides. Erythromycin, telithromycin, pyrithromycin, azithromycin, these are all macrolides. And streptomycin, kanamycin, capreomycin, these are all the aminoglycosides. And mechanism of action point of view, NEET PG point of view, there are two classes of drugs which will inhibit the 30S part of the ribosome and inhibits the RNA synthesis, and those two drugs are tetracyclines and aminoglycosides. Therefore, streptomycin is an aminoglycoside. It inhibits the RNA synthesis by binding to the 30S component of the RNA. Right now, the newer drugs which has come are bedaquiline, which inhibits the ATP synthase, and delamanid, pritomanid, which inhibits the mycolic acid synthesis, same as the isoniazid mechanism of action. Right now, we know the treatment regimen are HRZE, HRZES, HRE. Now, the newer treatment regimen which has been recently introduced is the BPAM regimen, wherein B stands for bedaquiline, P stands for pritomanid, which comes from the family of the delamanid only, and L is the linezolid. Linezolid is a bacteriostatic drug, and also moxifloxacin. Moxifloxacin is a fluoroquinolone. The mechanism of action of the fluoroquinolones is that it inhibits the DNA gyrase enzyme. Important NEET PG point of view. Right. Now, when is this BPAM regimen given? It is given in cases of rifampicin resistant TB and multi-drug resistant TB, and it is given for 6 months. So this is very important. Could be a potential NEET PG 2025 MCQ, BPAM regimen. Okay. Next, coming to the TB in pregnancy. Now, what will happen if a pregnant lady is having TB? What to do, how to approach? Now, first you got to see her duration of pregnancy. If it is less than 20 weeks or greater than 20 weeks. If it is less than 20 weeks, better advice for medical termination of pregnancy. Now, if she is not willing for a medical termination, or if she is willing, then do it and start TB regimen to the mother. Next, if she is not willing for MTP, then look at the duration of the gestational period. If it is less than 12 weeks, you have to give a TB treatment regimen to the mother. You should not give aminoglycosides and ethionamide. Instead, you got to add para-aminosalicylic acid. Why not to give aminoglycoside? We know tetracyclines and aminoglycosides are teratogenic. You can't give in pregnancy. It will have adverse effect on fetus, right? So you have to exclude aminoglycosides and ethionamide. Then add para-aminosalicylic acid. If the duration of pregnancy is greater than 12 weeks, you still got to omit aminoglycosides and add para-aminosalicylic acid and ethionamide. Here we did not give ethionamide also, but if it's greater than 12 weeks, we are adding ethionamide and para-aminosalicylic acid. Now, after delivery, you got to replace para-aminosalicylic acid with kanamycin. Now, once the baby is delivered, there is no fear of teratogenic effect, so you should add aminoglycoside also, right? Next is if the duration of pregnancy is greater than 20 weeks, you should directly start TB treatment, keeping in view that you have to omit the aminoglycoside class of drug and you have to add para-aminosalicylic acid, right? Next, in the next video, we will be discussing regarding the BCG vaccination, the DOTS and the NTB strategy. This DOTS and NTB strategy is important from SPM point of view and also from NEET PG SPM point of view. So all the best, keep studying, happy studying.